Hi, this is Dr. Daniel Ronel. I'm a board-certified plastic surgeon, and you're listening to Talk 1260 KTRC. This is Western Medicine, a show about plastic surgery and the realities of plastic surgery. Today we have a guest, Marian Urban, who founded the Sterling Institute 30 years ago. It's the premier medical aesthetics institute really in the Southwest. And I am lucky enough to have her on my team to take care of my patients before and after surgery. Hi, Marian.
Hi, Dr. Ronel. How are you?
Fine. So what do you do for us?
Well, basically, I take your patients before you put them under and get them ready for you so that they have a better healing process. And then I pick them up after you finish with them as soon as you remove the stitches and continue the healing process so that there's less chances of scarring, keloiding.
I think you just make the healing easier, less bruising, less swelling, faster recovery, you know.
Definitely. I mean, people, no matter who they are, they go sit with you and they agree to have the surgery, but you know, the night before or 2 days before, they're nervous.
Oh, yeah.
So I come in and I just really go over and I say to them, just as long as you do everything he tells you and we work with you, you'll be just fine. So we kind of take the edge off towards the end there before they go into surgery.
That's true. And it's also, it's a protection of your investment. If you're going to invest a lot of money in having a facelift, what Marian does is really help maintain those looks for years afterwards by teaching, you know, how to do proper skin care, et cetera, et cetera.
I mean, you care for people in the interim too.
Right. Most definitely. It's like I tell them, you know, surgery, microdermabrasion, laser, any of those things, we're just vehicles. It's not the cure-all permanent cure for what they're wanting to get done. But, and I tell them, you know, after all this investment you've done, you have to protect it afterwards.
Absolutely.
With your esthetician.
Like, what's something that you would do for somebody getting, for example, an eyelid tuck, you know, a blepharoplasty?
Well, you know, when I started working with you, I had designed this protocol, and I started working with the people, and I thought, well, this is crazy. I can't just take care of the eye area, because the whole face structure is affected by it. So what I do now is do an entire hour-and-a-half treatment on the entire face before they even go for a blip.
Wow.
So they get microdermabrasion, they get double enzyme with steam, and then what I do is everybody's different. So the masks all come out different for everybody. So what I do is I send them home with a mask underneath all their creams.
Interesting. What's a mask?
A mask could be anything. It has to be in a gel because you can't see it. You can go out in the street looking with a chocolate mask on your face. So it's a gel-based mask. It could be seaweed, it could be ginkgo, it could be anything that sits on your skin. And I tell them that after 2 hours they can take it off, but it's not going to hurt them if they spend the rest of the day with it. Then I layer, and I call that process, I feed the skin. I feed it until I have at least 7 to 10 layers on the face before they walk out.
Wow.
So the process that I do continues working throughout the day.
Great.
So they're ready for you.
All right.
Primed.
Yeah, they're primed for you.
Yes. What's something that you would do, say, after, you know, a facelift or something like that?
After a procedure, it all depends on the individual. It all depends on how they're healing. But say a typical normal healing process of a facelift or a blip is, that's when I work in with the oxygen and a lot of serums. And nothing, as we've discovered way earlier in our journey together, nothing with aromatherapy in any surgery. So everything has to be pretty much fragrance-free, chemical-free, so that's how we get them to heal. But again, what each individual gets is based on how they're healing, who they are.
That must feel so good, though.
Well, they're very happy. We haven't gotten any complaints.
Wow.
Now you also do some things for the body in liposuction.
Yes. That again, depending on the areas, what I do is I really deeply do microdermabrasion. And people ask why. Well, when you cut, there's less dead skin and buildup there that you have a night. For me, I envision it when you cut. It's a nicer cut. And then I do ultrasound. I stimulate the skin, and it's not an ultrasound that you would find at a gynecologist's office or a surgeon's office. It's a special made ultrasound for this type of work that you're starting to see in many plastic surgeons' offices.
Yes, that's
So.
true. Do you do ultrasound afterwards also to help bring
Absolutely.
the swelling down?
Absolutely. And then again, depending on the area that we do, I have giant tea bags, I call them, because I bring from Austria. I bring a lot of herbs and things from Germany and from Europe, basically. So I have these giant tea bags. They're excellent for pain, inflammation. So I put it on them, and then I put them in a nice little soft pack bed that they immerse themselves.
I know that you go to Europe once a year and you do teaching.
Yes, I teach the estheticians over there, and even though the estheticians can't do as much as we can do here in the United States as estheticians, but I tell them you cannot let your clients be smarter than you. So I always try to tell them what's current in the market as far as aesthetics goes.
Right.
So.
You're listening to Talk 1260 KTRC, Western Medicine with Dr. Daniel Ronel. I'm talking with Marian Urban from the Sterling Institute, my esthetician. Thank you so much for listening. We'll be back in a few minutes.